Good morning. This is Dennis Aguila, your Pickleball Physio here out of North Orlando. And I am here at the Pickler. Minor plug for them. It's a new club that I joined, and it's quite amazing. I just got through playing a few games here, and I love my fellow pickleballers, and I am here to serve you, to help you quickly recover, return back to playing from injuries related to your pickleball game. And I am here to help you tune up that most important piece of equipment, your body. And I can help my fellow pickleball players optimize their playability and ability to play confidently and injury-free. So I'm at your service here in Orlando. So that being said, today's topic is on Achilles tendinopathy and lower leg and foot and ankle injuries that I'll get into as I've played this game and seeing the frequency. It is on the rise of these Achilles tendinopathy and foot and ankle injuries, as I can attest myself as having. So let's first talk a little bit about maybe some of the misnomers of what is a tendonitis when you're diagnosed with it, or even a tendinopathy. So the tendonitis is the initial inflammatory condition that occurs after an injury or some type of trauma. So yes, you'll get the initial phase that lasts about 5 to 7 days of pain, swelling, tenderness over that area of your Achilles or foot. Probably the best advice that maybe many of you follow, but knowing me as a pickleball player, I will not listen to my body, and despite the strain or that initial pain, my adrenaline, my need for dopamine keeps me playing that one more game. I am wanting to keep playing despite the pain, and if you don't rest, ice it, maybe even compress it, elevate it if you feel or see the swelling. So that old rice recipe is often very helpful in a initial tendinitis or the itis injury. Then we get into the tendinosis. If you get imaging done after an injury and you get this finding on the test, whether MRI or scan, and you are told you have a tendinosis, the tendinosis is simply a thickening, laying down of that connective scar tissue to help heal the injury from whether it's a minor tear, micro tear, or even a partial thickness tear. You will get this thickening that, again, will tend to stiffen, will tend to have limitations in flexibility, or even create some additional pains in surrounding areas. So this is where me as a physical therapist will use my handy dandy set of tools. Many of you know them as Graston tools, or I liken them to instrument assisted manual therapy. So it almost looks like I'm using silverware, whether that look like spoons or butter knives. Pizza cutters is what some of my patients or clients will tell me that I'm using. But those are designed, again, to reduce some of that thickening so that you'll be able to improve your flexibility, pliability, malleability of the soft tissue, giving you freedom of movement and likely less pain. And there are other forms of different manual therapy techniques that I'd love to use on you, whether that be use of other modalities such as infrared or laser, or maybe even dry needling in some cases. So that is the tendinosis. That's once you get into that chronic stage beyond, let's say, 4 to 6 weeks, this is where that thickening will often occur, and you've now entered into the apathy So clients who tell me they have dealt with the tendonitis for months, or they'll even talk about their plantar fasciitis lasting for months. I guess you can say the correct terminology might be tendinopathy or plantar fasciopathy, but it maybe doesn't quite ring as well. In any case, this sort of next stage of inflammation within the tendon can be called a tenosynovitis. And that's where the inflammation and this inflammatory response takes place in the sheath outside of the tendon, where the tendon has sort of a lining around it, and the tendon moves through the sheath. And if you get that tenosynovitis, then that can become very painful, irritable, and if left unattended, can develop into the need for surgical intervention. So you don't want to go down that route. We as physical therapists understand the mechanics of how the tendon must be gradually reloading to build itself back up again. Once, like myself, you can almost say, tenderize the tendon with my instrument-assisted manual therapy and other techniques, and then gradually introduce medicinal doses of loading or resistance training on the tendon. So I'll often love to start them off in seated positions, like gentle calf raises to stimulate the soleus, and then also improve on working this particular muscle, sort of realizing the vast importance of this muscle called the tibialis posterior, which the tibialis posterior runs along the back side of the leg, comes around to the front supporting the arch, and then helps the foot do what they call a supination, creating this arch, again, building up the plantar fascia support. So working the tibialis posterior in both sitting and then gradually into standing, and then also working the small, tiny muscles within the foot called your intrinsic muscles. Those, again, lie just underneath your plantar fascia. For those of you that don't know what the plantar fascia is, it is just a thick piece of connective tissue that creates that arch in your foot, and it again extends from the heel up through and into the toes, particularly the great toe. So those that have plantar fasciitis will often complain of pain in towards the heel area, but also they'll be lacking this toe extension, whether that, especially the great toe, where that toe is supposed to be able to extend. If this is my big toe, it's supposed to be able to extend at least 50 degrees in order to sustain that arch position in the foot, not allowing the foot to pronate or roll in. And that again can create other problems within the knee, also further up the chain into the hip, creating strain into the hip, pelvis, and then lower back. Another, I guess, characteristic of the plantar fascia is that it doesn't have a really good blood supply because it's not truly a tendon per se. So it's healing that particular area up becomes a little tricky. So yes, trying to initially support the foot through orthotics can be helpful, or maybe even cushioned shoes. But what I'm learning, again, from my own experience, is that it's so important, again, to gain as much control and movement of the foot, particularly for me being a hyperpronator. I need to develop a greater control of supination and being able to improve my intrinsic foot muscle strength to keep that arch supported and strong. So I am sort of now changing my view, you could say, as I've come to the light of understanding, is that the foot, I have basically babied my feet for decades of wearing extremely cushioned shoes all the time, just finding the most cushioned shoes with a lot of elevation at the heel. And yeah, it felt good and comfortable, but now I'm realizing that my arches are continuing to fall and my hyperpronation is not truly improving. So now I've been working on barefoot walking, maybe not outside, but at least inside, and trying to toughen up my feet and working those intrinsic muscles and concentrating on positioning my foot in more of a neutral or even slightly supinated position that I'm having to, again, consciously think of. And then, as I stated before, taking in these medicinal doses of walking barefoot and even practicing some of these foot specific exercises, particularly stimulating the midfoot metatarsal joints, where I often see quite a bit of this metatarsalgia or this os peroneum, which is a condition of the fifth metatarsal being highly inflamed because of the peroneal tendons that attach to that area. And so I'll see this injury in some of my pickleball players, especially ones that have to move laterally from side to side at the kitchen. And so cutting back and forth is not so much a problem, but cutting laterally from left back to the right and so on, side to side, is stressful on the lateral portion of the foot, especially, yes, at that fifth metatarsal, the base of that fifth metatarsal. So the importance of stimulating muscle control, strength, and overall conditioning within the foot and ankle is key. And I love using the dense foam pad that you'll use with balance training. Also working with like a yoga block is an excellent way to work your foot. I like to kind of grab my toes on the outside of a yoga block to work the intrinsics of my foot. And then also I've discovered this other new tool called a sidekick, but it's basically an axis board that has a articulation at the heel and at the mid distal foot, allowing you to pronate and supinate both in the forefoot, and then you could change the pivot point and axis to work the rear foot as well, to work the heel portion. So I love using that as well in an open or seated position, and then in standing. So those are, again, some great ways. I also enjoy, as I'm treating myself, de-weighting my body, either in a pool or I actually prefer a cold tub now that I'm here in Florida and playing in this incredible heat dome we're in right now. That's why I enjoy playing inside right now. So using a de-weighting system, whether that is using the pool, because I have access to a pool, where you can work on these moves, especially the lateral moves, cutting side to side like you're at the kitchen, where you're sidestepping, you're again moving to the left and to the right like in a dinking rally. And again, just working the foot, the knee, the hip, the entire kinetic chain is just so marvelous to do in the pool. There's other ways that you can do that too within some outpatient clinics that have really expensive equipment that can de-weight you on a treadmill. But yes, I enjoy using the pool to get in some of those medicinal doses of resistance and assistance in the water. So stretching is very easily done in the water. I love using the step into the pool to stretch hamstrings, calves, and then also work on my foot control while my foot is up on the step. So I'll just practice doing that combination of inversion, eversion with pronation and supination of my foot. And as I build some speed in the water, that gets that resistance flow going and without extra pain. It is helpful to do exercises where you can get the reps in and get that circulation and flow of both blood, lymph, energy going. Another little tool that I've been playing with is just using a rebounder, just a little mini trampoline, to work your feet, ankles in a somewhat cushioned environment that doesn't pound away at your joints. And again, that helps with both circulation, lymph flow, and then, as always, reps is great for you to build the confidence in your joint, to stimulate those proprioceptors, those mechanoreceptors in your joint that will allow you to play more pickleball pain-free. So that is my recommendations for dealing with tendinopathy or your arthropathies that are within your foot, ankle, lower leg, plantar fascia, and again, just really working the foot into a more balanced position when we're playing. So this is, again, Dennis Aguila, your Pickleball Physio. You can follow me on my website. Maybe you can tell me what topics you'd like me to speak on, and I will help try to provide you with a little bit of knowledge from my 37 years of doing this. So again, thank you for listening, and we'll see you next time.